2020 to the medical student. So this introduction is going to be an introduction to what you're going to learn and how you should approach your breast block. GEMP2s. Okay, this is your first introduction to warts, and it's intimidating and daunting, and you're sitting here thinking, well, how am I going to approach it? The nice thing about your morning in the breast clinic is you have opportunity to spend time with patients under the supervision of doctors. So we'll start off by telling you a little bit about the breast clinic and a little bit about breasts. So the Helen Joseph Breast Clinic has been up and running since 2008. It is a clinic that I set up secondary to the Chris Honey and the Joburg Jen Clinic, and it's a massive multidisciplinary breast clinic. It runs 2 theatre lists a week, and which are just for general breast, and then also 2 breast reconstructive surgery lists a week. There are 2 clinics. There's a clinic on a Tuesday which sees triage patients who just walk in the door. It's an open access clinic. It is very, very hard for people to access healthcare in this country. They have to catch transport, go to a clinic, see somebody, a nursing sister who might not be sure why this 24-year-old is here, or turn around and say to the 24-year-old, well, it can't be a cancer. And 24-year-olds can get cancer. Breast cancer is neither ageist, sexist, nor racist. It affects anyone. We see young men with breast cancer. We see young girls with breast cancer. So what we need to be able to do is explain to people about how do you examine your breast, what to look for, and we need a friendly, open access clinic. So they come in on a Tuesday, they get seen by doctors, there are healthcare navigators there, and they get triaged and sent for mammograms and ultrasounds if they're over 35, or ultrasounds if they're under 35. The Thursday clinic is a clinic, a follow-up clinic, also a walk-in for anyone who's got any concerns. It is a big breast cancer clinic. It is a plastics and reconstructive surgery clinic. It has a survivorship, which means that people who've had breast cancer and are now past their initial treatment phase can come in and discuss any problems or concerns they have around side effects to medicines, general follow-ups, anxiety around cancer. The clinic also runs a genetic clinic, and it runs a special HIV-related clinic. So those are the Tuesday and the Thursday clinics. So we've mentioned why access is so important. Let's talk a little bit about breast awareness. So 25 years ago, most women that I was seeing at Chris Honey Barra had big advanced breast cancers. Over 80% had cancers over 5 centimeters. We've dropped that rate down to about 60%. But now, due to social media, we really hope that those levels come down quicker. So in other words, what do we want people to do? We want them to examine their breasts and be breast aware. So for ladies to stand in front of the mirror, check their breasts, see what their breasts look like, knowing that breasts are different shapes and sizes and one is often bigger than another. We want them to learn with the flat of the hand, to examine their breasts with the flat of the hand and check for glands with the arms on the side. So you as the medical students are going to practice this. So you're going to sit the patients up. First, you're going to talk to them. You're going to introduce yourself to them. You're going to take a history. You're going to take a history about family history. You're going to take a history about when they started their periods, did they have any babies, understanding that 65% of all women who present to a clinic have no identifiable risk factors whatsoever. 25% of them have vague family history, and under 10% have single isolated genetic problems, the BRCA1 and 2, such as what we saw with Angelina Jolie. So we're going to get them, take a history, you're going to examine them sitting and lying down. You never squeeze the nipple. All you do is you feel the ducts around the nipples and the thickening of the ducts under the nipples. When you feel for glands, you relax your arm to the side. You do not lift the arm tight, because then that's the position we have when we do an ultrasound and we don't really feel the glands so well. You inspect the skin, you feel for lumps, you look for redness, you see for any changes, and you then send the patients for the correct investigations. So you're now going to have a nice time enjoying yourself at the clinic, and then we will meet again at 11 o'clock and discuss the patients you've seen. I will now show you with one of the doctors how to do a breast examination You will then, under supervision, be divided into groups where you have an opportunity to speak to patients, take a history, examine them, and also follow through in terms of see what happens with radiology and talk to the lay navigators. Thank you.